First of all, I would like to welcome all participants, Third International Heart Congress. Also, I would like to thank Program Committee for kindly inviting me to the Congress with keynote lecture. My lecture about cancer and cardiovascular diseases, common pathogenesis mechanisms and risk factors. My name is Mekhman N Mamedov. I am professor of cardiology from National Research Center for Therapy and Preventive Medicine, Moscow, Russian Federation. I have not conflict of interest, nothing for declaration. According to WHO experts, in near future, cancers, coronary heart disease, and stroke will be main causes of mortality in adult population in worldwide. You can see risk regions based on WHO organization in Europe. And in some countries such as Spain, France, Holland and Great Britain, cardiovascular mortality risk is low. In some countries such as Italy, Austria, Germany, Sweden, cardiovascular mortality risk is moderate. But in more countries, such as countries of East Europe, Russia, North Africa, cardiovascular mortality risk is very high. At the same time, we can see that the cancer is leading cause of death in worldwide too. According to nearly 10 million deaths in 2020. The most common in 2020 were breast cancer, lung cancer, colon and rectum cancer, prostate cancer, skin cancer, and stomach cancer. And in world map, you can see high prevalence of cancer death in some regions such as North America, United States, Canada, some countries of South America and West Europe. While in Russia, in Asia and some countries of Africa and South America, cancer death is moderate. In this table, you can see the results of cross-sectional study which organized in central region of Russian Federation. And here we demonstrate the prevalence of major non-communicable diseases in adult population, in men and in women. More prevalence defined in coronary heart disease, about 14% in men and 10% in women. And then the COPT in men about 11%, in women 2 times less, just 5%. Type 2 diabetes mellitus, both groups in men and women, about 7%. And cancer was defined about 3% in adult population of Vladimir region. The last 15 years in Russian Federation, we can see slow progress of cardiovascular disease. The same tendency we can see in dynamics of cancer of various localization. Here is the structure of death in adult population of Russian Federation. You can see every second causes of death in adult population is cardiovascular disease. As second place, is the cancer, about 16%. And the last data from Russian Federation Statistic Department, mortality from cardiovascular disease 2 times more than the cancer. Last years in literature we can see more publication about comorbidity of cardiovascular disease and cancer different localization. This classical study is a prospective study about 10 years, patients with cardiovascular disease, about 2,040,000 patients with different cardiovascular disease. And in this study, analyzes prevalence of cancers different localization in patients with different cardiovascular diseases. In heart failure patients, about 55% had diagnosed cancer. In peripheral atherosclerotic patients, about 45%. In patients with coronary heart disease, about 40%. In patients with cerebrovascular disease, about 30%. The same prevalence we can see in patients with cancers. In patients with cancers different localization, we can see also high prevalence of cardiovascular disease. For example, in patients with lung cancers, about 45% had cardiovascular diseases. In kidney cancers, about 35% had cardiovascular disease. In blood neoplasm diseases, about 35% too. In brain cancers, about 30% patients had diagnosed cardiovascular diseases. This is a very well-known prospective study, the atherosclerotic risk in community ERIC study. This is published in Journal American College of Cardiology the last year. The study included 12,000 ERIC participants. Main age was 54. 55% were family and 25% was blacks, and about 3,250 participants has incidence cancer over a median about 14 years of follow-up. After adjustment for cardiovascular risk factors, cancer surveys had significantly higher risk of cardiovascular diseases, heart failure, and stroke, but not coronary heart disease. Breast, lung, colorectal, and hematologic lymphatic cancers, but not prostate cancer, were significantly associated with cardiovascular risk. Risk of developing cancers in patients with heart failure discussed very widely in literature too. In incidence of new cancers is high in patients with heart failure compared to the general population, which significantly worsens their prognosis. The management of patients with heart failure who have developed cancers for the first time is challenging, especially due to limited therapeutic options for patients with cancer. Possible correlation between heart failure and cancer is two. Is a general anxiety environment by the chronic inflammatory state and oxidative stress. And second mechanism of progression of heart failure and oncogenesis plays a key role. Hyperactivations of sympathetic nervous system and renin-angiotensin-aldosterone system. Also natriuretic peptides. Risk of death in patients with myocardial infarction and cancer, also discussed in literature very wide. Meta-analysis of 10 studies involving 7,200,000 patients demonstrate that cancer increases the risk of all-cause death with myocardial infarction compared with non-cancer patients. In subgroup analysis, cancer was associated with the risk of recurrent myocardial infarction and major bleeding, with no significant difference in the risk of stroke. However, no significant difference in the risk of cardiovascular mortality were observed in this meta-analysis. And one of the main key role in development of comorbidity cardiovascular disease and cancers various localization is common risk factors. We know risk factors divide to two groups. First, the non-modifiable risk factors is gender, age, family history. Usually, they used in assessing of diseases risk. I return to our cross-sectional study, which organized in Vladimir region of Russia. And here you can see this family history of major chronic diseases among men and women. And the main family history disease in men and in women is cardiovascular disease, about 33% in men and about 25% in women. Family history of cardiovascular disease. The second is the COPT in men about 20%, in women about 10%. Also, every 10th patient have family history for type 2 diabetes mellitus, and just 5% patients or adults had family history for cancer's various localization. Common genetic factors and mutation between cancers and cardiovascular disease possible too. Janus kinase 2, titin, and methylcytosine dehydrogenase 2 mutation, ataxia mutated serine threonine kinase, which regulate multiple cell injury response pathway, and several involved genes involved in DNA damage repair and cell proliferation. So, modifiable risk factors for non-communicable disease plays a key role in development of comorbidity, cardiovascular disease, and cancer too. They divide to three main subgroups: social and behavioral risk factors, biological risk factors, and environment risk factors. They plays a key role in development of coronary heart disease, stroke, cancer, COPD, diabetes, osteoporosis, obesity, and trauma. And this table demonstrate role of common risk factors of the chronic non-infection diseases. The main risk factors such as smoking, alcohol abuse, poor nutrition, sedentary lifestyle, obesity, arterial hypertension, hyperglycemia, hypercholesterolemia plays a key role not only in patients with cardiovascular diseases, also in type 2 diabetes mellitus, in cancers, and in COPD too. So, interesting results from the National Registry of United States. In patients with breast, prostate, uterine, and colorectal cancers, 14 years after diagnosis, cardiovascular risk factors were identified, such as smoking, excess body weight, sedentary lifestyle, hypercholesterolemia, hypertension, and diabetes. Compared to population without cancer of the same age, people with cancer have more cardiovascular risk factors. For example, obese about 62%, hypertension about 55%, diabetes mellitus about 21%, sedentary lifestyle about 18%, and smoke 5%. In Japanese cohort study analyzes the relation between cardiovascular disease and cancer, is taking into account these risk factors. The association between cardiovascular disease and cancer was assessed, taking into account a number of risk factors such as body mass index, smoking status, physical activity, dietary habits, high blood pressure, glucose, and total cholesterol levels. So after shows that the incidence of cardiovascular disease increased with an increase in the number of unfavorable cardiovascular indicators and risk factors. Interesting, this association was also evident in patients undergoing active cancer treatment. Cancer patients are not exceptions in maintaining a healthy lifestyle and managing risk factors to reduce the risk of cardiovascular complications. They are united by chronic inflammation, which play an important role in pathogenesis and progress of both diseases too. In the genesis of cancer as cardiovascular disease, a chronic inflammatory process occupies an important place, which is reflected in the development of comorbid condition. Some cytokines produced by diseases hurts cause mild inflammation that promotes also cancerogenesis. It should be emphasized that many chemotherapy drugs enhance the inflammatory process, aggravating existing cardiovascular disease or contributing to the development. Also, platelet plays an important role in the atherosclerosis, inflammation, immune response, and are also involved in the development or progression of cancer too. In vivo studies has demonstrated that thromboxane A2 production is increased in cancer patients, particularly in patients with stomach cancer, suggesting the crosstalk between platelets and cancers. This increased platelet activation in cancer patients may contribute to cancer-associated cardiovascular disease and thromboembolism. Tumor cells and secrete molecules that activate platelets, which in turn promotes cancer-associated inflammation, proliferation, speed, and immune evasion. Low-dose aspirin effectively reduces cardiovascular complications. Hopes are also pinned on the prospect for the use new antiplatelet agents. They may have a beneficial effect on cancer recurrence and improve the treatment outcomes of cancer patients. Thus, platelet inhibition may represent an innovative therapeutic strategy offered to the cancer patients from the perspective of personalized medicine. Also, in literature, we define the new players in the development of cardiovascular diseases and cancer. A marker with universal properties in non-coding RNA participated in the regulation of many physiological and pathological signaling pathways and are considered as a target for comorbidity of cancer and cardiovascular diseases. The multiple roles of cardiac stromal cells, endothelial cells, and fibroblasts and inflammatory cells as the link between cancer and cardiovascular disease. Also, the gut microbiota is considered as a new player as a crossroads between heart failure and cancer too. We have a small experience for analyzing cardiovascular risk factors and comorbidity in patients with cancer of various localization. This study included 180 patients with cancers of two localizations, lung cancer and intestinal cancer. The average age of patients with colorectal cancers was 58 years, and in group with lung cancers, 64 years. Patients were surveyed using the questionnaire, including social demographic indicators, family history, behavioral risk factors, clinical characteristics of the underlying disease and its complications, the presence of additional chronic disease, therapeutic and surgical intervention. In this table, you can see clinical characteristics of patients with cancers of various two localization, colorectal cancers and lung cancers. And you can see in colorectal cancers, incidence of metastasis, chemotherapy, radiation therapy was 3 times more than in patients with lung cancer. Radical surgery was same in lung cancers and colorectal cancers, about 80-85%. Family history of chronic diseases in patients with cancers, very interesting data we defined. In colorectal cancer patients, family history of cancers is very high, 54%. In patients with lung cancer, the same incidence is 31%. In lung cancers group, family history of cardiovascular disease is 17%, while in colorectal cancers, just 6%. Type 2 diabetes mellitus in family history, about 16 and 17%. Behavioral risk factors in patients with cancers various localization demonstrate that about 45-6% of with lung cancer smoking. Is colorectal cancers 28%. Very high prevalence of low intake of fruit and vegetable in both groups, about 80%. Adding salt to food, about 21% in lung cancers, about 32% in colorectal cancers. So we also analyzed comorbidity of chronic diseases in patients with cancer. High prevalence of arterial hypertension in both groups was defined. Coronary heart disease in every third patient with lung cancer and colorectal cancers defined too. Also, chronic stomach diseases was defined in 70% with colorectal cancers, and chronic kidney disease every 50 persons with colorectal cancers was diagnosed. While in lung cancer, you can see high prevalence of COPT, 62%, also history of myocardial infarction, about 14%. Quality of life was one of the main points for our analysis. We can see pain, discomfort, and anxiety and depression was diagnosed in every second patient with colorectal cancer and lung cancer. A conclusion for this study: in patients with cancer, the presence of cancer in family history takes first place among non-communicable disease. Smoking is more common in patients with lung cancer, and poor diet is more common in patients with colorectal cancer. In both groups with cancers, hypertension and ischemic heart disease are most often detected, while diabetes mellitus and chronic inflammatory disease of the stomach are more common in the group with colorectal cancer, while COPT is more detected in group with lung cancer. Pain, discomfort, anxiety and depression were found in every second patient with cancer, regardless of localization. And this slide demonstrates the importance of regular screening among adults for registration, for diagnosis of non-communicable diseases. In Russia, restarted the screening program in adult populations the last 10 years. We can see frequency of detection of disease during screening combined with self-visiting a doctor is very high. For example, in cancer, for cancers, 7 times more detection of cancers during screening comparing with a self-visiting doctor. Cardiovascular disease, about 3 times more detection during the screening compared with the self-visiting doctors. Also, type 2 diabetes, a similar incidence. Home take message. The number of patients with comorbidity of cancers and cardiovascular disease is growing worldwide. This is also due to the presence of common risk factors and pathogenic mechanisms. Against the background of increased survival in cancers and ongoing therapy, an increased risk of cardiovascular disease is monitored. In the regards, measures are required to conduct regular screening and control the risk of cardiovascular disease. Screening for cancers among people with cardiovascular disease, in particular with heart failure, required for the study. Against the background of measures to prevent replaces of cancers, it is necessary to develop comprehensive measures aimed at the secondary prevention of comorbidity condition. Dear colleagues, I would like to invite you to publicate your original and review articles in our journal. The International Heart Vascular Disease Journal is a pre-reviewed journal. It's published 4 times a year in 2 languages, in English and Russian. You can see more information at official site of the journal, heartvdg.com. So thank you for your attention.